Today we'll discuss on the topic menstrual cycle. So before knowing the menstrual cycle, let us first know what is a hormone. A hormone is a chemical released by a cell or a gland in one part or the other part of the body that sends out the messages that affect the cells in other parts of the organism. So a hormone, it is a chemical which is released by a gland in our body, and this gland will send the chemicals from one part of the body to the other part to do the various functions. There are two main types of hormones, that is the endocrine hormone and the exocrine hormones. There are two types of glands. That is the endocrine gland and the exocrine gland. This endocrine glands, they do not have ducts. Okay, so they will be responsible for secreting the hormones, and this exocrine gland will have ducts. The examples of endocrine glands are pituitary gland, thyroid gland, parathyroid gland, adrenal glands, etc. And the examples of exocrine glands are salivary glands, liver, pancreas, and sweat glands. What they will do, these exocrine glands will secrete the sweat, enzymes, mucus, sebum, etc. So these are the two types of hormones. Then next is the pituitary gland. So what is a pituitary gland? It is an endocrine gland. Why we are learning the pituitary gland here? Because for this menstrual cycle, there are various hormones which are released in our body. Because of that, our menstrual cycle is occurring. So all these are governed by the pituitary gland. So this pituitary gland will secrete the hormones which are responsible for causing the menstrual cycles. So pituitary gland is about the size of a pea and weighing 0.5 gram. It is also known as the master gland, and it secretes a variety of hormones which stimulate the other endocrine glands to secrete their own hormones. This pituitary gland, it will stimulate the hypothalamus of the brain to secrete the various hormones. This pituitary gland functions under the control of the hypothalamus. See here, it is also written under the hypothalamus. Now the question comes, what is hypothalamus? The hypothalamus, it is a part of the brain which is linked to the pituitary gland. This will stimulate the pituitary gland to release the various hormones. Pituitary gland is divided into the anterior and posterior pituitary. So there are various hormones which are secreted from the anterior pituitary and posterior pituitary. Among that, these hormones which are responsible for the menstrual cycle is secreted from the anterior pituitary gland. They are also known as the gonadotrophin or the sex hormones. These are the follicle stimulating hormone and luteinizing hormones in the females. Both of these hormones are released under the influence of gonadotrophin releasing hormone from the hypothalamus. So from the hypothalamus, it will stimulate the pituitary gland to secrete the gonadotrophins. By the help of the gonadotrophin releasing hormones, this follicle stimulating hormone and luteinizing hormone will be released. Follicle stimulating hormone. It is also called the FSH in short form. This regulates the development, growth, pubertal maturation, and reproductive process of the body. So this follicle stimulating hormone is responsible for the development in our body, growth, and maturation of the various pubertal characteristics and the reproductive process or the giving birth. These all are controlled by the follicle stimulating hormone. Follicle stimulating hormone and luteinizing hormone act synergistically in the reproduction. So there is another type of hormone, that is a luteinizing hormone. This luteinizing hormone and follicle stimulating hormone will work together in the process of reproduction. In females, the follicle stimulating hormones will initiate the follicular growth. So here, follicular growth. Here we have to know what is the follicle. The follicles are the small sac of fluid which is present in the ovaries. Inside the ovaries, this small sac of fluid called the follicles will be present. They contain the developing egg or ovum. They are secreted each month containing the egg, and they grow and mature. So the maturation or growth of the follicles will be controlled by the follicle stimulating hormone. Next hormone is the luteinizing hormone or the LH. They are also known as the lutropin. In females, the luteinizing hormone is secreted by the pituitary gland, through the gonadotrophin. Then this luteinizing hormone is responsible for maintaining the luteal function. That means they will help in the development of the corpus luteum and further help in developing the fetus. Apart from the luteinizing hormone, there is another hormone which is known as the HCG or human chorionic gonadotrophin hormone. This is a hormone which is produced at the time of the pregnancy. This will also help in the development of the fetus. So every month the follicle or the egg is released from the ovary. When it reaches the uterus, it will get implanted in the uterine wall or the endometrium after it fuses with the male sperm. For this implantation, the uterus forms a thick layer around the endometrium to help in implantation of the fertilized egg. So, when there is no fertilization, when there is no fusion of the male and female gamete, this ovum, which is released from the ovary, will not get implanted in the uterine wall, and it will dissolve into the uterus. And the layer which is formed by the uterus for the implantation is no longer used. Then it will lead to shedding of the layers, which contains mainly blood and other tissues. And it will come out of the uterus and continues for 5 to 7 days. Then again, in the next month, another egg will be released, and so on. And the cycle will continue. This is known as the menstrual cycle. So menstrual cycle is a 28-day cycle where various changes take place inside the ovary and the uterus. Now let's see the definition. Menstruation is a periodic discharge of blood and slough endometrium through the vagina. Menstruation occurs throughout a woman's reproductive life in the absence of the pregnancy. The average menstrual cycle length is 28 days. Average duration of mens is 5 plus minus 2 days. The blood loss per cycle is between 30 ml and usually greatest on the second. Now let's see what are the phases of the menstrual cycle. There are 4 main phases of the menstrual cycle. There are the menstruation phase, follicular phase or the proliferative phase, ovulatory phase or the ovulation phase, and last is the secretory phase or the luteal phase. First phase, that is the menstrual phase. The menstrual phase is the first stage of the menstrual cycle. It is also when you get your periods. This phase starts when an egg from the previous cycle is not fertilized because pregnancy hasn't taken place. So when the thickened lining of the uterus, which will support the pregnancy, is no longer needed, it sets through the vagina. During this process, combination of blood, mucus, tissue will flow out from the uterus. So this menstrual phase is ranges from 1 to 7 days, and this is the first phase where the bleeding occurs. Here what will happen, the uterus prepares the lining inside the uterus for the development of the fetus. When development does not take place, the shedding of the uterine lining will take place, which will lead to the menstruation. This is the Next is a follicular phase. This will occur from day 8 to day 11. Here, the lining of the uterus will thicken in preparation for the fertilized egg. So the process of thickening of the lining of the uterus for the fertilized egg to implant is known as a follicular phase. It will occur from day 8th to 11th. Then ovulation phase. Here ovulation is when the ovary releases a mature egg. Ovulation is the process where the mature egg is released from the ovary. The egg will travel down the fallopian tube towards uterus to be fertilized by the sperm. The ovulation phase is the only time during the menstrual cycle when you can get pregnant. Ovulation happens at around the 14th day if you have a 28-day cycle. After that day, the egg will die or dissolve if it is not fertilized. So ovulation phase is nothing. It is when the mature egg is released from the ovaries. The ovaries, as we know, the ovaries are present in both the sides near the fimbriae, and from here the ovum or the fertilized egg will pass through the fimbriae and it will pass through the fallopian tube. Then it will reach the lining of the uterus. After reaching the lining of the uterus, it will prepare itself to get fertilized by the sperm. If it is not get fertilized, then the shedding will take place. So the process of releasing the mature egg from the ovary is known as the ovulation or ovulation phase. This will occur from day 12 to 17, but usually on the 14th day it will take place. Then last is the luteal phase. Luteal phase occurs from day 18 to 28. That is after the ovulation. If the fertilization has not taken place, the corpus luteum fades away. The corpus luteum is made from a follicle that house a maturing egg. So we have already known the corpus luteum. This corpus luteum will develop and into the fetus if it is fertilized. When it is not fertilized, the corpus luteum will fade away. This occurs in the luteal phase or the last phase of the menstrual cycle. Here we can also see in the picture the menstruation phase will last for 1 to 7 days. Here the uterine lining breaks down and the menstruation occurs. Follicular phase or the proliferative phase is when the follicle is formed and released from the ovary, and on the other hand, uterus will prepare its lining. It occurs up to the 14th day. Next is ovulatory phase. Ovulatory phase happens when the ovulation occurs on the 14th day. Then secretory phase is when the endometrial lining again starts to break down or set, and then again from day 1 bleeding will take place, and then the cycle continues. Here in the next picture we can also see the changes in the uterus. In the stage 1, that is in the first stage, from day 1 to day 5 menstruation will take place. That means bleeding will take place. Then in the stage 2, that means from day 5 to day 13, it is a pre-ovulatory phase, which means before the ovulation. The egg will get prepared. Then in the stage 3, that is on the stage 14, the egg ovum will be released. The mature ovum will be released. Then in the stage 4, the endometrium will be thickened, and it is also known as a post-ovulatory stage. The endometrium will thicken and prepare itself to get fertilized, or on the other hand, it will pass out. So there are various menstrual disorders that we have to keep in mind. These are the various terms related to the menstrual cycle or menstrual disorders. The first one is the amenorrhea. Amenorrhea is the absence of menstrual period. It usually occurs during the pregnancy. Then primary amenorrhea. Primary amenorrhea is the absence of menstruation in a woman. Primary amenorrhea, it is the absence of the menstruation in a woman by the age of 16. So before the age of 16, the girl will not be having any menstrual cycles. So before the first menstrual cycle occurs, the period where there is absence of menstruation in the initial period of the woman, this is known as the primary amenorrhea. And then secondary amenorrhea, it is where an established menstruation has ceased for 3 months in a woman with a history of regular cyclic bleeding, or 9 months in a woman with a history of irregular periods. So secondary amenorrhea is when the person has menstruation has already established in the female body, but after that, if she has irregular periods or irregular menstrual cycles for around 3 months or usually up to 9 months, when the menstruation has ceased for a certain period of time, this is known as the secondary amenorrhea. Then dysmenorrhea, it is a gynecological medical condition which is characterized by severe uterine pain during the menstruation. So during the menstrual cycle, we experience abdominal pain or the uterine pain, which is also known as menstrual cramps or menstrual pain. This is a menorrhagia or hypermenorrhea. Hypermenorrhea or menorrhagia, it is an unusually bleeding and prolonged menstrual period at regular intervals. So here, it is the opposite of the amenorrhea. Okay, in the amenorrhea, what will happen? There will be no menstruation. Here, in this menorrhagia or hypermenorrhea, there will be more bleeding, which is prolonged or which occurs for a long duration of time, greater than the regular periods. And here, the volume of blood which is lost is also greater. Then next is a hypomenorrhea. Hypomenorrhea is here the menstrual bleeding will be there, but there will be very less amount of bleeding. This is also known as the scanty periods. Then metrorrhagia. Metrorrhagia, it is a uterine bleeding at frequent irregular intervals, particularly between the expected menstrual periods. Here, bleeding will be there at frequent and irregular intervals. There will be frequent bleeding and at irregular intervals it will occur. Then menometrorrhagia. Menometrorrhagia, it is a condition in which prolonged or excessive uterine bleeding occurs irregularly and more frequently than normal. Here, there will be excessive uterine bleeding, that too in irregular period of time and which is more frequent. And next is a polymenorrhea. Polymenorrhea is a medical term for cycles with intervals of 21 days or fewer. In a normal cycle, we have seen in a normal cycle it is 28 days, but here in this there will be only 21 days cycle. The period or the menstrual cycle will occur within the 21 days. Then oligomenorrhea. Oligomenorrhea is a frequent or very light menstruation. So here, very light bleeding will take place. Here, the interval is 35 days or greater. So this is all about the menstrual cycle. So the menstrual cycle, it is a periodic discharge of blood and other materials through the vagina, and it will occur throughout a woman's reproductive life in the absence of pregnancy. The usual cycle is around 28 days, and there are 4 main phases in the menstrual cycle. They are the menstrual phase, follicular phase, ovulation phase, and the luteal phase. The menstrual phase will occur from 5 to 7 days from day 1 to day 7. It will usually occur from around day 8 to day 14. The follicular phase will take place. And on the 14th day, ovulatory phase or the ovulation will take place.